Hi everyone, welcome back to the channel. I am Dr. Abhishek and in today's video I am going to explain you the different pathways for doctors who want to come to Australia and practice medicine. If you are a doctor and planning your journey to Australia, this video will clearly give you a clear roadmap. So the first pathway is AMC pathway, which is also the standard pathway. This is basically for the international medical graduates whose medical schools are not directly recognized by Australia. It is a two-step process in which the step 1 is AMC MCQ step. This is a computer-based exam in which you will get 150 questions and with each question you will have 5 options and single answer correct. Once you get done with AMC MCQ step, you need to book for AMC clinical exam. The AMC clinical exam is a OSCE based exam in which you will have 16 clinical based scenarios in which you have to pass at least 9 stations to get done with this step. Once you get done with this AMC MCQ step and AMC clinical exam, the AMC will release your AMC certificate. With AMC certificate, you will register yourself as a doctor, or basically, I will say as a provisionally registered doctor in AHPRA. So the OSCE exam is not just a clinical exam; it is a communication test as well for you. So I can say that it is a comparably tough step as compared to MCQ exam. Let's talk about the second pathway, which is competent authority pathway. This pathway is for doctors who have trained or worked in certain countries like UK, US, Canada, New Zealand and Ireland. If you have worked there or trained there or completed their licensing exam, you may be exempted from the AMC exam. Instead, you are assessed by the AMC and get directly registered in the AHPRA and directly apply for jobs. Talk about the third pathway, which is the specialist pathway. If you already have a specialist overseas, for example, a cardiologist, a surgeon, a pediatrician, or maybe a gynecologist, you can apply through this pathway. Your work experience and training is assessed by the relevant Australian specialist college. Depending on the outcome, you may be deemed as a substantially comparable, partially comparable, or maybe non-comparable. This determines whether you can work under supervision or need further training in Australia, or maybe you can directly apply to Australian healthcare system and work independently. Now let's talk about the last pathway, which is short-term training pathway. There is also an option for overseas doctors who want to come to Australia for short-term training or maybe fellowships. This pathway gives you an extra skills to your portfolio or maybe add some work experience in your portfolio. Once you get done with your training, you need to return to your home country until unless you switch to another pathway. So each pathway has its own requirement, but the good news is that Australia offers multiple options depending on your background. If you find this video helpful, please hit on the like button and subscribe to my channel for more AMC preparation tips. In the upcoming videos, I will explain how to, register on AMC account and proceed with document verification. Thanks for watching. See you in the upcoming videos.